Feeling sluggish or have flu-like symptoms that just don't seem to go away? Well, there is a risk. It could be valley fever, and if it's left untreated, it actually could be deadly. Valley fever is a fungal infection that attacks the lungs, and the health department says it's on the rise in Fresno County. Our Kaylee Hunt is live in Fresno. And Kaylee, who is most at risk?
Construction workers and farmers are most likely to get valley fever, and doctors tell me it is hard to diagnose because symptoms are very similar to the flu. The Central Valley is warm, dry, and sometimes windy, which Dr. Elham Ramadi with UCSF Fresno says is a perfect breeding ground for cocci, a fungus that causes valley fever.
In majority of cases, they are self-limiting. Our immune system takes care of them.
Ramadi says valley fever presents itself with flu-like symptoms like coughing, fevers, and headaches. But if symptoms last longer than a month, Ramadi says you might want to be tested.
In minority of cases, they can travel from the lungs through the blood system, and they can settle into bones or even brain.
The Fresno County Department of Health is trying to get the word out, educating more people about this infection so they can get tested and treated right away.
We are seeing more cases compared to other years. Starting in 2013, those numbers weren't in the thousands. Now we're seeing those numbers in the thousands throughout Fresno County. Why? Because there's more education out in the community.
Berber says those who work outside are more prone to getting this fungal infection than those who work inside.
It's very specific to people that are working outside, that are working in the farmlands, that are doing construction work. You don't see them in people that work in the offices. You see them in those individuals.
Now, one way to prevent getting valley fever is simply wearing a mask like this if you frequently work outside or you're working on a very windy day. Live in Fresno, Kaylee Hunt, KC24, local news that matters.